Assalamu alaikum. I am Amreen. Our assignment topic is detection of monosaccharide fructose and mannose, in which my subtopic is metabolic disorder related to the fructose and mannose. So we start with metabolic disorder. When metabolism process fail, it causes negatively alternation in the body, due to which abnormal chemical reaction take place, which result is the disturbance of normal metabolic process. The reason is genetics, hormone imbalance, disturbance of enzyme activity, dietary food consumption, and other factors are also involved. So move toward the metabolic disorder related to the fructose. The first is essential fructoseuria. This disorder is caused by the enzyme deficiency known as fructokinase, also known as ketohexokinase. This enzyme catalyzes the transfer of phosphate group from ATP to fructose as utilization in initial stage. This disorder can be detected by the screening of urine. Its symptoms include the jaundice and growth retardation, etc. The other disorder is hereditary fructose intolerance. This disorder is caused by the enzyme absence known as aldose B, also known as bisphosphate aldose B. This enzyme breaks down fructose 1-phosphate into glycylaldehyde and dihydroxyacetone phosphate. The symptoms include nausea, bloating, diarrhea, and abdominal pain, etc. The other disorder is lactic acidosis and hypoglycemia. Conversion of glycogen to glucose is decreased with the accumulation of high level of fructose 1-phosphate. Fructose 1-phosphate is a competitive inhibitor of phosphorylase, an enzyme causes the conversion of glycogen to glucose. It results impaired glycogenolysis and gluconeogenesis. Its symptoms include vomiting, diarrhea, and hepatomegaly, etc. The other is hypertension. A diet rich in fructose causes the rise of uric acid in blood. Fructose reduces the production of nitric oxide and make it difficult for vessels to relax and dilate. Its symptoms include heart disease, stroke, and blood in urine. The next disorder is myocardial metabolic dysregulation. High dietary fructose intake causes the cardiovascular disease risk by the production of hepatic uric acid and accumulation of visceral adiposity and ectopic fat. Its symptoms include fatigueness, indigestion, and shortness of breath. The last disorder is hepatic lipogenesis. High level of fructose promote the mechanism that upregulate the hepatic lipogenesis program. Lipogenesis is due to the accumulation of excessive fat in the liver. Its symptoms include extreme tiredness, mental confusion, and abdominal pain, etc. Now move toward the metabolic disorder related to the mannose. The first is human glycosylation. It is a group of disorders caused by the enzyme deficiency known as mannose phosphate isomerase. This enzyme causes the interconversion of fructose 6-phosphate into the mannose 6-phosphate. In this variety, tissue protein or lipid is deficient. Its symptoms include poor growth and low muscle tone, etc. The other disorder is D-mannose kidney damage. High doses of D-mannose may cause the kidney injury, bladder damage, or it may spread to the blood. Its symptoms include weakness, confusion, and fluid retention, etc. The other disorder is weight gain and obesity. It affects metabolism by weight gain and obesity and causes the composition of gut bacteria and rodent. Its symptoms include difficult breathing, sweating, and change in vision, etc. The other disorder is mannose binding laxity. This condition that affects the immune system. People with this condition have low level or deficiency of immune system protein called the mannose binding lecithin in their blood. It is due to the extracellular pathogen and autoimmune disease. It causes symptoms, very serious symptoms like pneumonia and meningitis. The last disorder is Muscle eye brain disease. It is an autosomal recessive disorder present from birth. Congenital muscular dystrophy. Individuals with this disorder are born with muscle weakness, hypotonia, myopia, brain abnormalities. This disorder is caused by the mutation in protein O-link mannose beta 1 2 and acetyl glycosamine transferase. This enzyme participates in O-mannose glycone synthesis. So this is all about the metabolic disorder related to the fructose and mannose. Thank you.